So good morning again, everyone. Thank you for joining us today for this training on ESG, or Emergency Solutions Grant Compliance. Today we'll be focusing on program participant eligibility. This is the first in a two-part training series, and the second part coming up soon this month will be focused on best practices and application. My name, in case I haven't met you yet, is Monica Porter. I'm joined by my colleague, Sasha Kane, and we work at Home Base, a nonprofit organization that provides technical assistance and training to housing and homeless service providers in San Mateo County. We're also joined by Lodi from HSA, so I'll pause so that Lodi can say hello now.
Hi, everyone. I'm Lodi Saba with the HSA Center on Homelessness. Thanks for joining today. Like Monica said, we partner with Home Base to put on these types of trainings, and today is going to be focused on ESG, rapid rehousing. So thanks everybody for joining. Also wanted to mention one of my colleagues, Matthew Hayes, is also on the call today. Matthew is a new staff with Center on Homeless team, so he'll just be on to observe and listen with all of you today. But yeah, thanks for being here, and I'll pass it back to Monica.
Great, thanks, Lodi, and welcome, Matthew. Would you like to say hi to everyone?
Hi, everyone. Nice to meet you.
Great, good to have you. You might have already seen when you joined us today, we are recording the training in case anybody was not able to join us live, and we will be distributing the link to the recording as well as the slides after the training. So let's go ahead and get started with our agenda for the day. So we will be covering a number of topics related to rapid rehousing ESG compliance. After an introduction, I'll be talking with you about ESG rapid rehousing eligibility for people who are literally homeless. And then I'll turn it over to Sasha to talk about specific considerations when working with survivors of domestic violence, as well as eligibility reevaluation and record keeping tips. We'll be sure to pause for any questions periodically, but feel free to ping us in chat if any questions come up. Which brings us to our next slide. I'm sure that you all are used to doing trainings on Zoom right now, but just in case, we ask that you all stay muted while not speaking, just to minimize background noise. But if you have any questions during the training, or if you're having any technical issues, please feel free to let us know through the chat, and we'll be happy to assist with unmuting you. As I noted earlier, we are recording this training, but the chat box will not be recorded. And to find the chat box, if you're on a computer, go ahead and hover over your screen with your mouse, and a bar similar to the one on the slide should pop up at the bottom with a chat option somewhere in the middle. So just to get us going today, let's do a quick icebreaker so that we can make sure we find the chat. Please share your name and your organization. And what is one song that you will never skip on your playlist? We'll give folks a couple more minutes to get going. I had a hard time trying to think of one.
And you came up with this question.
I know, I should have been ready to go. Otherwise, if the music is eluding you this morning, feel free to just go ahead and say hi, just so we know who all is with us today.
Here we go.
Awesome. These are really great. Selena, Justin Bieber, Bruno Mars, got a good mix. And yeah, that's fair. It's hard to pick one song. But thank you all for joining us in that brainstorming. Excellent. Great. Let's go ahead and get started with the main event here today. So in addition to this training, we just want to flag for you that there's a number of resources that provide additional information relevant to ESG and Emergency Solutions Grant compliance. The HUD Exchange website, this link is to a number of helpful training materials, and I'll go ahead and add it here to the chat in just a moment. Or if you really want to nerd out like we do at Homebase, the ESG program interim rule is available online, so you can go straight to the source. Or you are, of course, always welcome to email Homebase, and we'll be happy to look into any questions for you. And thanks, Sasha, for adding that link to the HUD Exchange in the chat. So let's go to the next slide. For just a bit more context to frame our training today, ESG is a homeless assistance program, and so only participants who meet one of the defined categories of homelessness can be served by ESG rapid rehousing. Some of this is going to sound familiar, but just as a quick refresher, HUD's final rule defining homeless became available in January of 2012. There are 4 main categories under which households can be considered homeless, and there are specific documentation rules for each of these categories. When available, third-party documentation is the preferred documentation of homeless status. Next slide, please. So why are we covering eligibility documentation today, and why is this important? It's easier to prevent errors than to correct them. Backfilling documentation is a pain, and worse, it can result in clients being exited from the project. We also need to be cognizant of the presence of HUD monitoring, and monitoring findings can impact future funding applications, or worse, can result in having to repay grant funds. Next slide. So as I mentioned, there are 4 categories of homelessness under HUD's definition. Category 1 is literally homeless individual or family. Category 4 is an individual or family who will imminently lose their primary nighttime residence with no subsequent residence, resources, or support networks identified. The third category is unaccompanied youth or family who meets the homeless definition under other federal statutes. And category 4 is an individual or family that is fleeing or attempting to flee domestic violence. So as we modify this slide here, today we're going to be focusing on categories 1 and 4. ESG rapid rehousing assistance may be provided to program participants who meet the criteria under category 1 or who meet the criteria under category 4 and live in an emergency shelter or other place described in category 1. Next slide. In addition to verifying homelessness under category 1 or category 4, ESG also has an income restriction, and Sasha's going to talk about that with us a little bit later this morning. So now let's get started with talking about category 1, literally homeless, what it means, and how to document it. Next slide. So category 1 is defined as a household that is lacking a fixed, regular, and adequate nighttime residence. And that can mean any one of 3 subcategories. Having a primary nighttime residence that's a public or private place not meant for human habitation, living in an emergency shelter, transitional housing, or hotel or motel paid for by a charitable organization or government program, such as Project Roomkey, or exiting an institution after 90 days or fewer, and imminently before having entered that institution, having lived in what we're going to call streets or shelter, just as shorthand. Client files documenting literal homelessness only need documentation to support one of these situations. And so we're going to talk about each of them in turn. But first, a note on order of priority for documentation. In terms of documentation, third-party verification is always the preferred method of certifying homelessness for an individual or household who's applying for assistance. The easiest way to get that is to check HMIS. But if there's no record, if it's a new client, maybe the applicant says that they stayed at a shelter. And so you'd want to reach out to that program that they mentioned they'd stayed in. or maybe they mentioned having received services with another organization. And so you can get in touch with them to see if they have documentation of that. Staff certification based on intake conversation or a self-declaration by the client is only permitted when you've attempted to but cannot obtain third-party verification. And so if you use either of those, you must also document all attempts that you've made to obtain third-party verification in order to use second or first party. Are there any questions so far? No. Okay, let's get started with the next slide and feel free to let us know if any questions come up. So let's jump in to talk about how to document client eligibility for the first subcategory of literal homelessness. And so in this subcategory, the client's primary nighttime residence is a public or private place that's considered not meant for human habitation. Examples of this would include living in a car, a park, an abandoned building, a bus or train station, an airport, or campground. There are 3 types of acceptable eligibility documentation in order of preference. The best is always written third party. As I mentioned, probably the easiest way to document this is to check HMIS for a record of homelessness, print it out, and add it to the client file. Other options include a signed letter on letterhead or a completed homeless certification form from a homeless street outreach provider. And that would include the dates of contact and the location and a detailed description of the client's living conditions. If you've exhausted third-party verification options and are not able to obtain third-party verification, then you can move to second party or, if needed, first party. Here, second party documentation, as I mentioned, requires both staff certification based on intake, as well as staff certifying attempts to secure third-party verification. And so for staff certification based on intake, you'll want to include the month and the year when the applicant experienced homelessness, and a description of the intake conversation with the applicant and the reason you believe that they were living in a homeless situation. The last resort, if none of these are available, is first-party documentation. And this requires both the client's self-declaration of homelessness and a staff certification of attempts to secure third-party verification. A quick note here that for Category 1 homelessness documentation, it's not permissible to use community member observations. So that is the first subcategory. Now to turn to the second subcategory within Category 1, which is living in an emergency shelter, safe haven, or hotel or motel with certain funding sources. To explain the hotel or motel situation a bit more, it needs to be paid for by a charitable organization or a government program for low-income individuals in order to fit within the literally homeless category. So if the hotel is paid for by an agency to divert a client from congregate shelter, the client retains homeless status. But if the hotel is paid for by the client themselves or by a family member or friend, then the client is not considered homeless. Again, for this subcategory, there are 3 types of acceptable eligibility documentation in order of preference. Written third-party verifications are similar to the previous subcategory and include HMIS record, this time of a stay in an emergency shelter, safe haven, or hotel or motel, or a signed letter or homeless certification from an emergency shelter or safe haven provider, or from an organization that is paying for the hotel or motel stay. If you've exhausted third-party verification options, second-party documentation would require both staff certification based on intake and, again, those attempts to secure third-party documentation. And as a last resort, first-party documentation can be used, which requires both client self-declaration of homelessness and staff certification of attempts to secure third-party documentation. Any questions so far? All righty. So on the next slide, Also in the second subcategory of category 1 is exiting transitional housing. And again, this subcategory has a similar documentation structure as the others. The preferred method being third-party verification from HMIS, a signed letter or written certification of homelessness, this time from a transitional housing provider that would verify the transitional housing stay and the homeless living situation prior to admission to transitional housing. And if needed, you can provide first-party verification, again, along with certification of attempts to secure third party. On the next slide, the third and final subcategory within category 1 applies to clients exiting an institution after 90 days or fewer, and immediately before entering that institution was residing in streets or shelters. To explain this subcategory a bit more, examples of institutions include places such as jails, hospitals, and inpatient treatment centers. And this subcategory applies only to people who, prior to being in that institution, were living in streets or shelters, and not if they were living in transitional housing before they entered the institution. To demonstrate eligibility within this subcategory, you need documentation of the institutional stay with start and end dates showing that the stay was for 90 days or fewer, and documentation of homelessness immediately before being in that institution, with a similar structure to the previous subcategories of third party, second party, and first party options, with third party being preferred. Next slide, please. So to document the institutional stay, the preference is for written third-party documentation again, and this would be through discharge paperwork or a referral from an official at the institution. Either way, that documentation needs to include admission and discharge dates to show the length of stay was 90 days or fewer. And if it's not possible to get third-party documentation of the institutional stay, you can provide first-party documentation if you provide both client self-declaration and, again, staff certification of attempts to secure third party. As a reminder here, if you're using oral statements as documentation, such as an oral referral from an institution like over the phone, then programs should document those oral statements in writing in the client's file so that it is all there in writing when monitoring comes around. Next slide, please. So here we want to pause to acknowledge that there is a bit of an asterisk on the last subcategory that we covered in the form of a waiver that is in effect during the COVID-19 pandemic. So HUD has recognized that people are residing in institutions for longer periods of time as a result of COVID-19. They might be staying in jail longer because they have postponed court dates, or they might be staying in hospital longer if they've been infected with COVID-19, for example. And so HUD has made available this waiver, which states that an individual may qualify as literally homeless so long as they're exiting an institution where they resided for 120 days or fewer and resided in an emergency shelter or place not meant for human habitation immediately before entering that institution. And the waiver is in effect until June 30th of this year. So until June 30th, at least, the eligibility cutoff is set at 30 days longer than usual. This waiver is only in effect for agencies that have notified HUD that they are using the waiver. And so if you're unsure of whether your agency is using this waiver, please check with your supervisor. And thanks to Sasha for adding in the chat. This is a link to the HUD memo that was issued at the end of March, which details this waiver and its effective dates. On the next slide, to wrap up our overview of documenting eligibility under category 1, a note on timing. So the aim is to document homelessness the night before program entry. However, third-party evidence for category 1 can be up to 14 days old. For example, if someone were to enter your program today, April 15th, their documented night of homelessness could date back to April 1st. If the homeless certification does not fall within 14 days of program entry, then intake staff need to seek other forms of documentation in order to establish the client's homeless status and eligibility for the program. Are there any questions on Category 1 documentation or anything that we have covered so far? Okay. Well, now I will turn it over to Sasha to talk with us about eligibility for clients who are fleeing or attempting to flee domestic violence.
Thank you. So this category includes folks who are fleeing or attempting to flee domestic violence. And to qualify, they also have to not have another residence, and they have to lack the resources or support networks to obtain other residence. And when we talk about domestic violence in this context, it's that super broad definition that I think folks are pretty used to seeing at this point, but just do want to note that it does include dating violence, sexual assault, stalking, and other dangerous or life-threatening conditions that relate to violence that make the person afraid to return to their primary nighttime residence. And to unpack that even a little more, within those other dangerous life-threatening conditions, we also have human trafficking. So that this definition also covers human trafficking, including sex trafficking. And a rule that's particular to ESG rapid rehousing is that folks who are fleeing are only eligible if they're residing in shelter or on the streets or any of those other categories that we just covered a minute ago. So you might be asking, like, why bother? Why does HUD even include category 4 in eligibility for rapid rehousing? So if you have someone who's fleeing DV, that enables you to use less strict documentation requirements. I'm going to go over those requirements in just a minute, but basically, if someone's fleeing, then it's much easier to document their eligibility than all the rules that we just went over. So what does that look like? Do we have any victim service providers in the training right now? Are there any victim service providers or whose primary mission is to provide services to survivors? I'm looking at Lodi. Do you know? Since you know everyone on this call, I presume. Is there anyone here that, nope? Okay, so then I will skip over this, but basically they're super simple. For DV providers, you just need the certification of homelessness. But for everyone here, it sounds like, it's still pretty simple, but you need just that first party client self-certification that saying that they're fleeing, they don't have subsequent residence, and they don't have those resources or support networks, and that they're residing in one of those category 1 spots. If and only if safety wouldn't be jeopardized, then you should try to document that statement with some sort of written observation to document that they're fleeing, or a referral from an organization. Like maybe the person's worked with another housing provider or service provider, maybe they've worked with a social worker, or maybe they've connected with a healthcare provider or law enforcement agency or legal assistance provider. Basically, if there's any other agency where they've sought service, it's great to get that documentation as well. But again, only if safety wouldn't be jeopardized. Always the client has the final say on what's safe and what's not. So generally, to recap, all that's required is that person's oral statement. But if basically your program should document that oral statement in writing. So if the client's just telling you about how they're fleeing and whatnot, you should write it down for record keeping, and that's all you need. So much simpler than documenting category 1. I know we've covered basically now actually all of the content related to the definitions and the documentation, and like it seems clear cut when we're going through it in training, but obviously like when you're out there with clients, it's never quite as clear cut, and folks' lives are pretty complex and don't fit neatly into these HUD boxes that we've just addressed. So we're happy to take questions now, but also if you're ever working through some sort of gray area or have eligibility questions, we're always reachable by email or phone. Any questions before we do some hypotheticals? Right. Okay. So we have just a couple hypos, and for this one, I'm going to ask folks to respond in the chat. So Jack presents at your program, and 5 months ago, he was incarcerated. He's getting out today, and prior to entering prison, Jack had been camping in the woods since he had nowhere else to stay. Would Jack fall into category 1? If you could just type in yes or no in the chat. I feel like I need to like have a Jeopardy YouTube pulled up as folks are thinking. Any thoughts on if Jack qualifies as category 1? Thank you, Morgan.
There's also, can you hear me? Sorry.
Yeah.
Okay, I changed my headphones over. I know that there's also the category for incarceration exiting within like 30 or 60 days of incarceration. I think that used to be like category 3. So I don't know if that's, or I know that that was one of the qualifying homeless qualifications, but I believe so. So I'm going to leave it there.
Close, very close. We did trick y'all though. Jack unfortunately does not qualify because he was incarcerated for 5 months. So the cutoff is typically 90 days, but with the COVID waivers right now it's 120 days. But he still doesn't, this was a tricky one, and he doesn't qualify. So what if he had only been incarcerated for 120 days? Would someone be willing to go off mute and chime in with the type of documentation that the case manager would need to have, or like just one example of documentation that would be sufficient to show that Jack qualifies? And don't worry, for purposes of the recording, the spotlight will still be on me. So even if you come off mute, we won't know, we'll just hear your voice.
Can you guys hear me?
Yeah.
Okay. A certification of homelessness?
Yeah, so what sort of documentation would be needed in this case if Jack was only incarcerated for 120 days?
For 120 days, and now he's in homelessness?
No, he's coming out
Now
today.
he's literally.
So,
Oh,
I mean,
okay.
he's getting released today and going straight to your program. Very good discharge planning person worked with him to connect him straight to you.
Okay,
So what
other than like
documentation?
the certification of homelessness from a third party service provider, which would be the releasing agency,
Yeah,
No? Okay.
perfect. One more thing though. Jack was in the woods. Remember that Jack was in the woods prior to being incarcerated. For our folks exiting institutional settings, you have to document the length of stay and their prior living situation. So is there an example of how you might document the prior living
If he was
situation?
living in the woods prior to, and he was
Mhm.
within not 5 months living in the woods or 5 months in jail or whatever, only in jail within the parameters and then living in the woods prior. Because he wouldn't be connected with any exterior service providers, I think you would have to have him self-certify as homeless, and then you yourself would have to certify him as a first party.
Yep, that all works. So there's several different options, and thank you for sharing that option. So we could have that discharge paperwork, as you mentioned. Perfect. And maybe Jack's never had contact with any outreach worker, so you'd want to have that self-declaration, as you said. If possible, if he had had contact with an outreach worker prior to his institutionalization, then that's great. But if not, then that self-declaration works. Perfect. Okay, so as part of the CARES Act, HUD has to ensure that there are policies in place that prevent duplication of benefits. So what's duplication of benefits? Basically, and I'm going to start saying DOB because duplication of benefits is a mouthful. DOB happens when someone receives financial assistance from various different sources for the same purpose. And that assistance adds up to more than they need to cover their expenses. So what's required from HUD's standpoint to prevent this and to comply with the requirements is to set up procedures to make sure that DOB doesn't occur. So you have to set up a process to identify and prevent duplication to effectively manage the multiple funding streams related to COVID response and to target ESG resources to meet needs that aren't already being met by all the funding sources that have come out since COVID. So that can be done, or that has to be done per the HUD requirements by creating policies that include the following requirements. There has to be a requirement that any program participant that is getting ESG assistance has to agree to repay it if it's determined to be duplicative. So subrogation agreement, fancy word, but legally is basically just adding to your program participant agreements a clause that says that if the household receives some duplicative assistance, that they'll repay the ESG funds. And also, in addition to that, you have to set up a protocol to monitor compliance based on the risk of duplication of benefits. So how do you figure that out? So a method of assessing whether the use of ESG will duplicate other financial assistance that has already been received or might be received would include evaluating the current programs available. So what other funding sources are available on the local level, on the county level, from the state, on the federal level, as well as current and anticipated assistance that might come in from other nonprofits or faith-based groups, and basically talk to the household about it. So HUD has prepared this cheat sheet, and I have not done, I'll grab that link for you in a minute, because I didn't do the trick that Monica used in pasting the link, and I can't grab it from my PowerPoint right now. But basically, HUD has made this list of active federal CARES Act and COVID response programs that can help you identify different funding sources that might be available to households and prevent the risk of duplication of benefits. So how do you actually determine duplication of benefits? And we'll walk through an example in just a minute, but basically to analyze whether duplication might be happening, you'd want to walk through these steps with folks who are coming into your program. So thank you, Monica. As typically you'd assess the need of the household. So you'd figure out the amount of assistance, the total cost, the total financial assistance that they need. But then you take the extra step of figuring out any other financial assistance that they've already gotten, they're getting right now, or that they expect to receive soon. And then you subtract that second step from the first step. So to calculate, you compare the amount of assistance that they've already gotten or are likely to get with the total need to figure out the maximum ESG assistance that you can provide. And then, as with all HUD requirements, you keep a record of that in the client file. So easier to illustrate with an example. Here's a family that has suffered job loss due to the economic impact of COVID, and they're seeking rental assistance under ESG. They're looking, they need to pay back 3 months of arrears that they owe for the last place where they were living. And they're looking for 2 months of future rent. And I'm going to use super easy numbers that do not at all reflect the reality of rent in San Mateo County, just because math is hard on the fly. So bear with me with these ridiculous rent numbers. You'll be assessing the need first, right? So say their monthly rent was $1,000 before, and you are a magic worker and are able to find some apartment that is $1,000 a month. So their potential need for those 3 months of arrears and 2 months going forward totals up to $5,000. Your next step is to determine any assistance that they might already be getting. So say that you've set up this process in the application or in the interview with the household as HUD requires, and you're like talking to them about what they're already getting, and turns out that they've been working with a local faith-based org that's provided $250 a month to support the household over the course of the last 3 months. And except now that aid is no longer available. The family says that they haven't applied for any other assistance, so they don't expect that there will be any other money coming in. So basically what you have to do to prevent duplication is you take that total need from step one, the $5,000 that we calculated, and you have to take out the faith-based assistance. So you take out $750. And to arrive at the actual quote unquote unmet need. So the max that you can provide with ESG funds is $4,250. And then you just want to maintain documentation of that calculation. So basically, this requirement means that when you're calculating folks' needs and trying to figure out how much ESG assistance you're going to provide, you have to consider other forms of financial assistance that the household has gotten or has applied for. Any questions about this? Okay. And we have just a few slides left. We're going to go over just a few simpler requirements now. About income, that come into play when you're reevaluating folks' eligibility for rapid rehousing. So as we mentioned earlier, you don't have to do this up front. There's no income requirement up front. But once you do reevaluate folks, you do have to take into consideration their income. So as you know, that initial evaluation has to be conducted to figure out how much ESG assistance you're going to be providing and how much the household needs to regain stability minus what they're already getting from other sources. So during that initial evaluation, you don't have to do any kind of like household income assistance, income assessment, but you do have to reevaluate every year. So, or at least a year. Basically, the participants' eligibility and types and amounts of assistance have to be reevaluated at least once a year for them to continue receiving rapid rehousing. And, oops, I forgot to advance slides. And at minimum, that reevaluation has to establish that the participant still lacks resources and support networks to maintain their housing without ESG assistance, and that the household doesn't have an annual income that exceeds 30% of AMI as determined by HUD. So, for example, these are the AMI numbers that we've pulled for San Mateo, and you'll see that the 2020 AMI for a family of 4 is $143,100. So 100% of AMI for a family of 4. Basically, what the ESG requirements indicate is that their income cannot be any higher than 30% of AMI or $52,200. That is the max that they can earn in order to continue receiving ESG assistance. Question?
Hi, Sasha? Yeah, I think I missed it. So at the annual assessment, if they are over the 30%, what did you say? Would they still qualify, or will we have to plan
so
ahead?
you don't even have to like go through this process at the beginning in terms of like calculating whether they meet that requirement. Obviously, you'll talk to them about income to figure out how much they need, but they don't need to meet the 30% requirement until a year in.
Okay.
Like after a year, if they earn more than 30%, then they're not eligible. But up front, they are.
And so how long after the annual assessment would they have to close them out if they exceeded? So if it was a 1-person household, if they exceeded that 36,000 at the annual, is there a grace period that we could, work with them, continue to work with them?
Gotcha. That is a great question. I can't think of an exact number that I've seen HUD set off the top of my head, but I'll definitely look into that and follow up with the group.
Or should we be doing the annual assessment like a month prior, so then we could, determine that for the, their eligibility then? I don't know.
Let me look into that, because I'm not sure if you talk to them earlier and now you know that they're earning more, then I think you have to act on that per HUD. So let me see, and we can dig into it and see what the best strategy would be on this front.
Okay, cool. Thank you.
Okay. So a few record keeping tips, We're going to go over some tips that we've gathered through talking to providers about what works well for them, and also talking to folks about their experiences with HUD monitoring and what HUD was looking for when they came to monitor, and what makes it easier to pass HUD monitoring and not get any findings. So one of the things that we always come back to in terms of the recommendations is really like how crucial it is to have organized files. So the more organized, user-friendly, and consistent your case files are, the easier it is for HUD to find what they're looking for, and without digging through other things that might raise other questions that you don't want them to start digging into. So, and it's also just good to ensure for internal compliance checks so that those can be done easily. So one of the things we always recommend is to have a table of contents and tabs in case files to so that there's fewer distractions when HUD comes to monitoring, and so that HUD is able to find what they're looking for. So if you have a tab for eligibility documentation, and HUD can go right to that and not look through the entire file and potentially find other things that aren't relevant to their monitoring, but now raise questions in their head about something they want to look into as a result. And basically, as far as HUD's concerned, if you haven't documented something, it didn't happen. So including as much detail as possible to tell a complete story is absolutely essential. So for example, if you're using self-certification to document homeless status, and you filled out that portion about your attempts to get better documentation, and you just say that you tried to get better documentation, you tried to get third-party documentation, and you weren't able to, all you're saying is that you complied with the grant requirement, but you're not showing it by providing detail. And what you want to do is basically list all the steps that you actually took, so that HUD can see that there was good faith effort to try to get third-party documentation. And another thing to look out for that is something that we come across is that case files, we see this kind of often, case files will have different enrollment dates that are inconsistent across different pieces of documentation in the file. So like maybe their intake form says they enrolled on April 1st, and then there's like another form in there that has a different enrollment date. So of course there's different staff that might be filling out the intake form than the like the person's case planning form, whatever other forms are in there. But you want to make sure that the enrollment date is consistent across all of those forms, so that you don't have conflicting documentation that raises further questions for the monitor. So what happens if documentation is not compliant? You've used all your best practices, you have your case files organized, and you find out that there's some documentation that's not compliant, or there's a gap in the documentation, because HUD documentation requirements are tricky and it happens. So what do? You just want to make sure that you're addressing it. Basically, you want to do an assessment of the issue and the gap, and try to figure out how many case files were affected, how many of those are out of compliance, and then make a plan about how you can become compliant. If there's something you can do to bridge the gap and fix the documentation. It can be also helpful, and we absolutely recommend reaching out to HSA or the Department of Housing. And once you've reached out and you've gotten the resources you need and you understand the issue and you've made a plan, you'll just execute the plan and fix the problem for as many clients as possible. In some cases, we really recommend reaching out to the HUD field office to let them know about the issue and your proactive steps that you're going to take to fix the documentation to make sure it doesn't happen again, but not always. You might not need to reach out to the field office every time, but if there's an instance where there's been a substantial or like a really expansive lack of compliance, then it can be helpful to reach out to them ahead of time so that they don't hear about it for the first time in monitoring. But before you reach out to the field office, do connect with HSA or DOH and check in first, or reach out to us and let us know and we can provide some guidance. So what if a current client is ineligible? And this sort of gets at the income question of like what happens if they're above AMI, above 30% AMI once you're doing their reevaluation. But I know it doesn't provide any kind of time frame, so we'll definitely follow up on that. So if you find there's a gap in documentation and you've done your best to try to backfill it, but you just can't document the client's eligibility, like maybe they were ineligible when they were first enrolled, or maybe too much time has passed and you just can't backfill the documentation, you will want to take immediate action and work with that household and the CoC to create an alternate plan to transition out of the program. And everyone's goal is to keep them from becoming homeless again. But so hopefully they can be transitioned to another program or connected with more flexible resources that aren't as strict as ESG. This isn't like a situation where if they're ineligible, you exit them immediately. No, so you'll want to work with HSA or DOH, or if there's other resources that your agency has that are more flexible to help the person transition to those supports. You want to ensure that the documentation you have in the meantime is as accurate and complete as possible. And of course, exiting the client is absolutely a last resort if you can't fill the gaps in the documentation. So I think, yeah, that actually brings us through all of our content slides. So happy to take any questions that you may have about anything we've covered today.